Mental health is the ability to cope with everyday life, manage stress, and function at home, work, and school. Mental health is not just the absence of illness. It includes the ability to make decisions, solve problems, form relationships, and maintain a positive sense of self. For example, a patient who feels anxious about a new diagnosis but asks questions and follows the treatment plan is demonstrating healthy coping. Mental illness occurs when thoughts, feelings, or behaviors interfere with daily functioning. This may include difficulty thinking clearly, controlling emotions, making sound judgments, coping with reality, or forming relationships. For example, a patient who cannot sleep, cannot concentrate, and feels overwhelmed every day may be experiencing a mental health disorder. Mental health professionals use the DSM-5-TR to identify mental health disorders and guide treatment. As an LPN, you do not diagnose mental illness, but you play an important role by observing behavior, reporting symptoms, and supporting the plan of care. Mental health exists on a continuum. A person's mental health can change based on stress, illness, life events, and support systems. For example, a patient may cope well most of the time, but experience anxiety after surgery or hospitalization. Stress is unavoidable and affects each person differently. Stress is usually negative, but can sometimes be positive. Stress often leads to anxiety. For example, a patient may feel stressed before surgery, even if the procedure is routine. Anxiety is a feeling of fear, worry, tension, or uneasiness. Some anxiety is normal and helpful, but excessive anxiety can interfere with daily life. There are 4 levels of anxiety: mild, moderate, severe, and panic. Mild anxiety is normal and helps with focus, such as feeling nervous before a blood draw. Moderate anxiety causes difficulty focusing and noticeable behaviors like pacing or nail biting, such as a patient waiting for test results. Severe anxiety includes physical symptoms like nausea, chest tightness, and difficulty following directions. Panic is the most intense level. The patient may feel out of control and believe they're having a medical emergency. Common anxiety disorders include generalized anxiety disorder, panic disorder, and phobias. Generalized anxiety disorder involves constant worry about everyday life. Panic disorder includes repeated panic attacks with chest pain, shortness of breath, and dizziness. Phobias are strong, irrational fears such as fear of needles, heights, or flying. Nursing interventions for anxiety include maintaining a calm environment, speaking slowly and clearly, staying with the patient during anxiety episodes, encouraging deep breathing, documenting behavior, and reporting suicidal thoughts immediately. For example, sitting calmly with a patient during a panic attack and guiding slow breathing. Somatic symptom disorder involves real physical symptoms that cause distress even when no clear medical cause is found. The symptoms are real and often worsen with stress. Examples include chronic pain, fatigue, and stomach problems. Conversion disorder occurs when emotional stress is expressed as physical symptoms, such as temporary loss of speech after trauma. Illness anxiety disorder involves extreme fear of illness with few physical symptoms. Factitious disorder occurs when a patient intentionally causes or fakes illness without obvious external reward. Treatment for somatic symptom disorder may include medication, relaxation techniques, stress management, and behavioral therapy. Nursing care includes taking complaints seriously, avoiding arguments about symptoms, building trust, and encouraging expression of feelings. Post-traumatic stress disorder, or PTSD, occurs after experiencing or witnessing trauma. Symptoms include flashbacks, nightmares, avoidance, mood changes, and increased startle response. Symptoms must last longer than 1 month. PTSD is treated with therapies such as cognitive behavioral therapy, cognitive processing therapy, and prolonged exposure therapy. Complementary therapies include yoga and animal-assisted therapy. Nursing interventions include building trust, using calm communication, active listening, encouraging family involvement when appropriate, and reinforcing medication compliance. Mental health disorders are common and treatable. As an LPN, your role is to observe, support, communicate, and provide compassionate care. Your calm presence can greatly improve patient outcomes.